And I have the pleasure of welcoming you to this community Tele-Town Hall. Thank you so much for joining us. Now, we understand that making the best decisions for yourself and your loved ones is important, and we are thrilled to have these medical experts with us this evening to provide factual information. Over 1 million people have tested positive for COVID-19 in South Carolina, and that number continues to grow each day. This evening, I am joined by Dr. Ada Stewart of Cooperative Health, Dr. Jane Kelly of the South Carolina Department of Health and Environmental Control, Dr. Peter Loper Jr. of Prisma Health, and Miss Rosalind Goodwin with the South Carolina Hospital Association. Now, over the next hour, these top community health experts will discuss the lingering impacts of the pandemic in our state, our county, and communities, answering questions regarding COVID-19, vaccinations, and the physical and emotional impact this has taken on our community. And I know, like myself, everyone has been affected in some way with this pandemic. Well, if you would like to ask a question at any time during this meeting, please press 0 on your telephone keypad. You will be connected to a staff member who will note your name and question and then place it into the queue to ask that live question, okay? Once again, thank you all, everyone, for joining us. And also, once again, the panelists, thank you very much. We appreciate your time. So let's get things started. We begin with Dr. Ada Stewart, a family physician with Cooperative Health in Columbia, South Carolina, and is a board chair of the American Academy of Family Physicians and recent past president. Dr. Stewart, thank you so much for joining us today.
Thank you. Thank you so much for this opportunity.
Absolutely. And it's important that we have individuals like yourself in the field who knows exactly what to say during this time here. So for the first question, Dr. Stewart, what do you feel is the most common misconception about COVID-19 and the COVID-19 vaccinations?
Oh my goodness. So there are many misconceptions and myths surrounding the COVID-19 and also the vaccines. One of the most common one that I hear and that I see as I travel around the country is that, COVID-19, if I get the disease, then I do not need to get the vaccine. We do not know how long by getting the disease itself, how long that immunity will last. So it's very important that you do get vaccinated. No matter if you have gotten the disease and recovered and did well, you still need to get vaccinated. And when we look at the vaccine itself, one of the most common misconceptions that I hear is that these vaccines were developed so fast that they can't be safe. There's something wrong with, the vaccine because of how quick they were able to be rolled out. The work that was done prior to the vaccine rollout, the research, that started many, many years ago. We think about the coronavirus that SARS way back in 2002, I believe. That work around what we can do to develop a vaccine started way back then. And when we were inundated with the COVID-19, those researchers were able to really speed up a lot of the work that had already been started. No regulations or nothing was done as far as bypassing any of the regulations or anything that we needed to develop to determine whether the vaccine was safe, whether it was effective. All those things were done in a way that kind of helped us to, bypass a lot of that paperwork and the things that kind of hold things up as far as being able to roll these things out. The vaccines, we know that we've been able to give over 500 million doses, and they're safe and they're truly effective. So hopefully that answered those particular questions. So thank you.
Dr. Stewart, thank you. And with that, another question. So how does COVID-19, the vaccine, compare to other childhood vaccinations that are required for school?
All right. So, the vaccines that we have now that are required for kids really are there to prevent disease, to prevent serious illnesses. And that's what our COVID-19 vaccine is there to do. Prevent disease, prevent illness, prevent death. And there's really no other difference. Right now, they are not required, but we know around the country, as I've seen, different areas have different requirements as far as school vaccinations. But, you know, that's something that we have to recognize, that this is no different than these other vaccines that we already have out there. They're preventing the disease, they're preventing serious illness, and they're preventing death.
Mm-hmm. Dr. Stewart, thank you so much for those answers there. Again, for those of you who are joining us, my name is Fraendy Clervaud, and I'm with the Richland Library for a community Tele-Town Hall. And I'll be your moderator for tonight. And if you're listening to our community Tele-Town Hall, where we are having an important discussion with top medical professionals regarding the COVID-19 pandemic, if you would like to ask a question, press 0 on your telephone keypad now, and you will be connected. So we are going to go ahead and open it up right now to the phone lines. So we're going to go ahead and do that. It looks like we have a question here on our chat. Okay, so this question this question is coming from Abraham. And so the question is about variants. So Dr. Stewart, I'll ask you, or anyone else who may want to jump in about this. Is there any concern about any other variants?
I know that a virus can transmute itself when it piggybacks on a bacterium. But what I'm asking basically is the new transmutation. What are we doing about the new vaccine for the new transmutation?
You know, so right now, we know that the vaccines that we have are effective against the new variants. We continue to do work and continue to do research to see that and to make sure that we still have a vaccine that is effective as these variants keep coming up. This is something that is continuing to be worked on. The studies are just ongoing and continuing. And I would love to turn it over to Dr. Kelly to piggyback on this particular issue.
Absolutely. No, I would echo what you said. What we know right now, the main variant that is circulating in South Carolina and the country as a whole is Omicron. And the vaccines are highly effective against Omicron. But if it's been more than 5 months since you got your vaccine, you really need to get your booster to get the full benefit. But yes, the vaccines are highly effective against Omicron. Now, what about this new one, BA2, that is starting to go around the country? Studies thus far show that vaccine is also effective against BA2. What's going to happen in the way distant future? We don't know. But one thing we have learned in this pandemic is that we've had huge advances, huge improvements in making vaccines. So the vaccine manufacturers have learned how to tweak their vaccines. So if we get a variant that's not covered by the vaccine, there is the possibility that they can change that vaccine to cover a new variant that comes out. Right now, we don't need it. Our vaccines are very effective against these variants.
Well, Dr. Kelly, that is a great transition to a question on the line. We have Melinda on the line with a question about booster shots. Go ahead, Melinda.
Okay, my name is Melinda. And my question is, I got a booster shot on Saturday, and on that Monday, I found out that I had COVID. Should I take another booster shot?
You know, you ask a great question, and it's an opportunity for us to talk a little bit about vaccines. So if you don't mind, I'd like to just take it backwards and just talk about some of the basics, because I think some people are worried that, well, if I need a booster, does that mean that the vaccine doesn't work? No, no, no. You know, think about all those pediatric vaccines you give to your kids, right? It's a rare vaccine that's only given once or twice. Usually you need a booster. That booster is like a reminder to your immune system, because your immune system's busy, right? I mean, it's not busy just with that vaccine. It's busy with all the other viruses and bacteria and dust mites and everything else you breathe in all day. So the booster gives you your immune system a reminder, a heads up. Hey, pay attention. This is what's important. So for your situation, you got your booster on Saturday. Sorry that you then got your infection on Monday, but basically, you know, between Saturday and Monday, that's not enough time for your immune system to have really kicked in. I hope that your primary series, you know, the original dose you got, maybe it didn't protect you 100% from getting infected, but I bet it did protect you from getting severe disease. And that's what we look for in a vaccine. You know, you get vaccinated not to protect you from the sniffles, but to keep you out of the hospital, out of the morgue. So in terms of your question, when do you need another booster? No, I don't think so, not at this time. Now, we're waiting to see whether the recommendations are going to be to get yet a 4th booster. Now, I'm not talking about infinite boosters. A lot of vaccines that we give get 4 doses, even 5 doses, but only time will tell what's going to be the optimal course. Right now, you don't need another booster. Just hang tight.
Dr. Kelly, thank you so much for that. And we have another question on the call. Denise with a question about vaccine hospitalizations. Good evening, Denise.
Okay. As older people, even though they've had their shots, are getting sick and having to be put in the hospital, and sometimes numbers of times, and having to be on oxygen for a long time. Why is that?
If I may, I'll take that question. Anybody
Yes,
else can certainly jump in. You know, your immune system as you get older is not as good as when you were younger. Vaccine doesn't take as effectively. That's why, for example, we make a recommendation for older adults that they get, for example, the shingles vaccine, or if you're over 65, that you get a different flu shot, one that's like 4 times higher strength, because as you get older, even if you're a pretty healthy older adult, vaccines just don't take as well. Your immune system is not as robust, not as strong as it used to be. Now, we are seeing some hospitalizations among people who are vaccinated, but I want to point out, for example, if we look at deaths from COVID-19, 90% of them in the United States are among people who were not vaccinated. And more than half of those were since vaccine has been widely available. So everybody seems to focus on the one person who was fully vaccinated but got really sick and ended up in the hospital and maybe even died. Unfortunately, that does happen, especially in people who are immunocompromised, like people who have had an organ transplant, like a kidney transplant, again, because unfortunately, the vaccine doesn't work really well for them because of medications that they are on. So, you know, just trying to emphasize that vaccine does work, but there are limits. You know, older adults, people with multiple medical problems, people who've had an organ transplant, people with cancer chemotherapy, you know, they are not going to respond as well to a vaccine, but a vaccine will help them.
Absolutely, and I'll certainly piggyback off of that from the Hospital Association, and looking at the data for the last several months, about 80% of our hospitalizations are from people who are unvaccinated, but there is still a 20%, 15% of people who are vaccinated who still do end up becoming hospitalized. And as Dr. Kelly just mentioned, for those reasons, but the vaccine, without question, helps to reduce the chance of death and prolonged hospitalization and severe illnesses and effects after you may contract COVID. So the vaccine, of course, is very effective in doing those things, but there is still a small percentage of people who may end up in the hospital because of other complicating factors, even though they're vaccinated.
All right, thank you all so very much for that. Really appreciate that. And with that, Dr. Jane Kelly, we are switching gears over to you. Now, Dr. Jane Kelly is a board certified internist with over 35 years of experience in clinical medicine and public health in domestic and international locations. She currently serves as the Assistant State Epidemiologist for the South Carolina Department of Health and Environmental Control, also known as DHEC. Dr. Kelly, thank you so much for being here this evening.
Well, thanks for organizing this.
Absolutely. So Dr. Kelly, can you please define herd immunity? Why is it important? And what will it take for Richland County to reach herd immunity?
So the term herd immunity is actually taken from animal husbandry, veterinary medicine. The idea is if you had a herd of cattle, for example, and there was some disease that you could vaccinate against, do you need to get vaccine into every single cow? Then the answer was no, as long as a certain portion of them were immune, disease couldn't spread. Because, whether that was a bacteria or a virus, if you had a certain percentage of them that were immune, it would stop right there. Now, we've kind of taken this term into human medicine, but, there's a little bit of a problem. There's a way in which I don't like the term personally, herd immunity, because it's not all about a magic number. It's about biology and behavior. So when I say biology, I mean, how contagious is the disease you're talking about? Well, this new Omicron variant is much more contagious. It spreads more easily. So, this time last year when we were talking about, we need to reach, 70%, for example, herd immunity. Well, Omicron's a game changer. It spreads more easily. We need more people to be immune to stop the spread. But number two is behavior. So biology, how contagious is the virus, but also behavior. How many people are vaccinated? How many people are wearing masks? How many people are getting together in crowded indoor situations? So I can't hang a number on herd immunity. What I can say is it's combination. It's a combination of how many people have been vaccinated and boosted. Don't forget that booster. If it's been 5 months since you had, your 2-dose vaccine, I'm serious. This is routine. We do boosters in all sorts of other vaccines. This is normal. You need to get that booster. Remind your immune system what's important to pay attention to. But the other thing is how many people who may have had COVID. I heard Dr. Stewart earlier talk about, if you've had COVID, that it's still important to get vaccinated. That if you had COVID before, you can cut your chances of getting reinfected in half if you get vaccinated. So when we talk about herd immunity, what are the numbers for Richland County? Well, I looked them up right before this call. We know among people who are age 5 and older in Richland County, people who could get vaccine, 57% have completed a 2-dose series. 67% have had at least 1 dose. That's a little higher than the state as a whole, so that's good, but we certainly want it higher than that. But we have to take into consideration, a lot of people did get COVID, especially during this Omicron surge. And yes, they have some immunity. They have some protection, but you can make that protection even stronger by getting vaccinated. We know that not just from studies in the United States, studies in Israel, studies in other countries that are giving lots of booster doses. So I just want to emphasize that. And as long as I'm talking about those numbers, I also noticed that in South Carolina as a whole, who is our lowest number of vaccinated people? It's not necessarily black versus white. Our rates of vaccination among people of color, African Americans, Hispanic Latinos, are sometimes higher than white people. The lowest group is the youngest group, especially people age 5 through 17 years, but also the 18 to 30-year-old crowd. A lot of them are not vaccinated. And I'm sure it's because they think, it's not that important. I'm young and healthy. I'm not going to get, serious disease. But unfortunately, that's nothing in life is 100%. Some people in those age groups do get severe disease. So we are still recommending vaccination for all. If we could get, if you're talking about where do we need to focus to reach herd immunity, it's vaccinate those young adults.
Dr. Kelly, we did have a question from a caller. We're not going to cut to the caller. Amanda had a follow-up question to that. She said, to be clear, Dr. Kelly, are more boosters unnecessary?
We don't know yet. So, so right now it's the 2-dose primary series and a booster at 5 months. And again, if you look up what the pediatric, the childhood vaccine series is, for so many things, that's exactly what we do. We give 2 shots in the beginning, separated by a period of time, and then we come back later on, 6 months, a year, whatever, to give that booster dose to remind your immune system. So it's the same kind of thing here. Will we need a 4th dose? I don't know. I can't predict the future on this. Maybe. In fact, what's going on right now, for example, I mentioned the country Israel, because they started giving booster doses before we did, and we can learn from their experience. They are giving 4th doses right now. They're giving it to people over age 50 because they're at highest risk, and they're giving it to workers in healthcare settings because they get exposed the most. So we're going to learn from them. Let's see what that 4th dose means to them. Right now, what we are seeing is if you get the regular series and a booster dose, you've got high protection against severe disease.
Okay, Dr. Kelly, thank you so much for that. Again, for those of you who are joining us on the line, my name is Fraendy Clervaud with Richland Library for a community tele-town hall. I am your moderator for this evening, and if you're listening to our community tele-town hall, we are having an important discussion with top medical professionals regarding the COVID-19 pandemic. If you'd like to ask a question, please press 0 on your telephone keypad now, and you will be connected. At this time, we have a question from Jesse about masks. Good evening, Jesse.
Yeah, hi, thanks for doing this. My question is about masks, and with the CDC loosening the guidelines, I'm kind of wondering why. Is that a message that masks are not helping to stop the spread, or is that just so much public pressure? So if you could clear that up. I still wear mine when I'm out, and obviously I don't want to if it's not helping.
Any doctors or medical professionals, you all could answer that.
I don't want to monopolize things, but I'll put in my 2 cents and then ask others to do so as well. I wear my mask and I'm vaccinated and boosted, but I'm over age 65. So I want that extra protection. So CDC has loosened their guidelines, but it varies county to county. And that is critically important. If you're they've got these new measures that they're looking at. And by those new measures, if you're living in a county that has low community spread, low community level, they're saying you don't have to wear a mask. You always may wear a mask, especially if you're older adult or you've got medical problems, you have diabetes that puts you at increased risk, or you're living with someone who's got lupus or HIV and you're worried about, you don't want to infect them. You can always do that extra measure of protection. Now, Richland County right now is at a high community level measure. So the recommendation would still be for anybody living in Richland County to wear a mask if you're in an indoor setting, not at home, an indoor public setting.
Okay.
But masks do help. Nothing in life is 100%, but they definitely do help.
And speaking of masks, we have Tori on the line. Tori, another question. Good evening, Tori.
I've had my booster and I've had my shot. And I've been around a lot of people that I know that have COVID. And so what I wanted to know is, once someone's had COVID and they return back to the workplace, do they still need to wear their mask? Do they think that they don't have to wear their mask after they've had COVID and return from their quarantine?
I can make a comment on that. You know, the important thing, as Dr. Kelly said, is nothing is 100%. Even though you may have had COVID and you've been vaccinated and also boosted, you can still have a breakthrough infection because nothing is 100%. So how best to, protect yourself and protect others who may be around you, who we may not know what their disease process is, whether they have an underlying condition, something that make them more vulnerable to COVID and could, really seriously impact them. So again, in areas such as where we are in Richland County, that has a high transmissibility of COVID-19, it's best to go ahead and wear your mask to protect others. It gives you that extra added boost and that extra protection. I still wear my mask as I see patients within the clinic, also as I am outside of the clinic in indoor settings. If I go to a grocery store, just for that extra layer of protection, being vaccinated and boosted, I just want to make sure that I continue to protect myself and continue to protect those, including those who may not have had the opportunity to be vaccinated. There are many individuals, such as kids under 5, who are not eligible for the vaccine. And so how best to protect those in making sure that I protect them by wearing my mask in addition to being vaccinated and boosted.
Dr. Stewart, thank you so much for that. And to the callers, we want to thank you for calling in. We're going to work through your questions. We want to go ahead and go over to introduce another panelist tonight, Dr. Peter Loper. He is a pediatrician, psychiatrist, child and adolescent psychiatrist in the Pediatric Acute Crisis Stabilization Unit of Prisma Health. Dr. Loper is also an assistant professor of pediatrics and psychiatry at the University of South Carolina School of Medicine. Dr. Loper, good evening.
Hi.
Thank you so much
for having me.
Oh, absolutely. Thank you for joining us tonight. So Dr. Loper, can you talk about the impacts of COVID-19 on the mental health of our youth and what caregivers can do or to look out when it deals with mental health concerns in children?
Yeah, absolutely. So I think that we've all experienced that isolation that was really at its peak in lockdown and when schools shut down and things like that. The reality is, though, that humans are inherently social creatures. And so anytime you move human beings from the context of community and specifically meaningful interpersonal interaction embedded in community, human beings tend to not do well. And the demographic that's really most sensitive to being removed from meaningful interpersonal interaction embedded in community is really going to be our adolescent demographic, ages 13 to 18, just by virtue of the fact that their developmental stage, psychosocial developmental stage, where those meaningful interpersonal interactions embedded in community is how they're really navigating, consolidating their identity and moving forward in life. And so impact on mental health during the pandemic, we've seen a lot of depression, a lot of anxiety, and unfortunately, we have seen an uptick in suicidal ideation and suicide attempts. Red flags, things to look out for as parents. So the first thing would be you're a typically confident child. Now all of a sudden seems really insecure. And this may manifest as reassurance seeking, right? So typically confident, now all of a sudden they're consistently seeking your reassurance. That could be a red flag that they could be depressed or in some cases anxious. Another one would be that they're getting in fights with everybody. Teachers, peers, mom, dad, guardians, siblings, they're just having a really hard time getting along with folks. That could be a red flag that they're suffering from a depressive episode. The next one would be if they are starting to perceive that everybody dislikes them or is dismissive of them. And so if that's a new behavior in your kid, that may be a red flag that they're suffering from some depression. And then the last two are really big ones. The first one is social withdrawal. So if they start to withdraw, that's a really big red flag. And then the last one is if their performance starts to drop. Usually the performance drop, that's kind of one of the first indicators you may see. Once that performance starts to drop, that's when you really need to hone in. And it's not just school performance. It can also be extra performance in their extracurriculars. If they're an athlete, performance dropping in basketball or tennis, wherever it may be. If they're in band, they're not wanting to engage with those activities anymore, and they're losing interest. So those are there's 5 red flags that you look for, and those are the red flags that I would suggest parents kind of keep their eye out for.
Oh, those are some really great red flags there, Dr. Looper. Thank you for that. Now, trends have shown that the Omicron and Delta variants are affecting children more than previous variants. Can you speak to what's possibly causing that, and what advice could you give parents?
Yeah, sure. And so I'm just going to admit, I've learned so much from listening to Dr. Stewart, Dr. Kelly, Dr. Goodwin. This has been such a great learning experience for me. And the bottom line, my answer would be, and I'll defer to the expertise of others, is that it's just easier to catch Omicron. And so more kids have gotten it. One of the things I did really want to emphasize, though, is that, yes, the vaccine has been proven, sufficient, robust data that it's safe and effective for kids ages 5 and older. If you're 12 and older, get the booster. That's really important to acknowledge that. But the other thing I really wanted to mention, if I may, is that any intervention, whether it be a vaccine or otherwise, must be set on the foundation of well-being. And so when we're looking at risk factors for an adverse outcome with COVID infection, one of the biggest risk factors, in fact, last time I checked, it was the biggest risk factor for adverse outcome was going to be being overweight or specifically obese. So, man, what better time to commit to getting well and to losing some weight and getting in the gym and engaging in some healthy lifestyle changes that may support your overall well-being. Because not only will that make you make the vaccine more effective if you choose to get it, it's going to make you more resilient to the next variant, to the next pandemic, God forbid.
Good questions there. Again, for those of you who are joining us, my name is Fraendy Clervaud with Richland Library for a community tele-town hall. I'm your moderator this evening, and if you're listening to our community tele-town hall, we are having an important discussion, as you have maybe heard, with top medical professionals regarding the COVID-19 pandemic. If you would like to ask a question, please press 0 on your telephone keypad now, and you will be connected. We do have a caller, Sarah. She has a question about 4-year-olds, vaccines, and activities. Good evening, Sarah.
Hi. Can you hear me?
Yes, ma'am. Go ahead.
Can you hear me?
Yes, we can hear you.
I'm wondering, so he's talking about, okay, older kids. My son is 4. He was 2 when the pandemic started, and, I've been really protecting him and keeping him home. And now, he's at the age where he wants to, join soccer and gymnastics with his friends and stuff like that. And, it's a year until he can get vaccinated. Should I just, keep him at home for 1 more year and wait till he's vaccinated? Or is this, an important time in his development to let him go and do that kind of stuff with kids? I just feel so sad. He's been stuck at home for so long.
That is such a great question. It really lands with me. So the one piece of advice that I would recommend to anybody, any parent listening, is we really got to make sure that we don't confound urgent from most important. And we have to make sure that we're intentional with balancing infection control measures with making sure we're supporting our children's healthy psychosocial development, because their healthy psychosocial development is going to allow them to integrate into community and be healthy and well throughout the duration of their life. What I would say is, hey, have at it. Let your 4-year-old get out there and explore the world. If your 4-year-old gets sick, we have tremendous interventions to help support your 4-year-old. Per the best data that we have, the chances that your 4-year-old is going to have an adverse outcome that warrants a hospital admission are much less likely. And so we want to support that idea that we can't inhibit our kids' psychosocial development just by virtue of fear. And it's okay to be afraid, but sometimes the best thing with fear is to look it in the face and just engage with it and go for it.
Dr. Loper, just going back, you mentioned something right there, that there are certain type of, if I'm not mistaken, treatments or things available for those who are unvaccinated, like under 5. Have those things been made throughout the pandemic that can be utilized? And what are some things that are we talking about here?
So I would have to defer to my infectious disease colleagues as to specific treatments tailored. However, what I would say is the mainstay at our children's hospital for treating a child who is admitted for decompensation due to COVID is supportive care. So providing supplemental oxygen if they need it, doing suctioning, things like that. If they need to be intubated, we have that capacity to do those things, in addition to whatever treatment the infectious disease doctors may recommend. And so we have those resources here in the community. We have an outstanding children's hospital.
Okay. For next question that we do have on the line, Tina, she has a question about research regarding long COVID. Good evening, Tina.
Good evening.
Hey,
Hello?
good evening. Go ahead.
Can you hear me?
Yes, Tina, we can hear you. Good evening.
Okay, great. My question was about long COVID. What research and information are you guys developing to combat that and to give more people information that are dealing with long COVID?
I would love to comment on that because I see this every day. The difficult part is, everyone needs a primary care clinician because a lot of times we have individuals who may have been impacted with COVID-19, and they have persistent symptoms. They may have a cough that continues. They may have that brain fog where they can't remember the things that they previously used to be able to remember. They may have some type of cardiac disease, may have palpitations or new shortness of breath or persistent headache. And the only way to truly tell whether this is something that could be associated with long COVID versus another condition is to have that clinician, physician who has constantly been taking care of that individual and know that, Mrs. Smith had COVID and now she is having these particular symptoms that more than likely could be long COVID. Of course, we are looking to make sure there's not another disease process going on, but that is the way for us as clinicians to be able to, kind of follow this disease process and see whether this is a result of COVID or another condition. So again, everyone who is exposed to COVID-19 may respond in a different way. And I tell my patients, you don't know how you're going to respond. You may have a mild infection. You may have a little infection that, you may have a cough and then it goes away, or you may have something that persists. Months after you have recovered from the disease process. And the only way for us to really tell whether this is associated with long COVID is for us to be able to follow that patient and continue to see how they are progressing and to make sure we have ruled out other infections. And then looking at the data from our colleagues, as a family physician, we have a website that kind of tells us what we're seeing out there within our communities across the country. And of course, Dr. Kelly, I'd love for you to jump in and talk about what you all are doing. But it's looking at those patients and making sure that we are, seeing those impacts from individuals who have had COVID and what they are experiencing following those particular disease processes.
The one thing I would add, if an unvaccinated person has had COVID and then they've got long COVID, there are more and more studies emerging that are saying if you get vaccinated, that it decreases the duration of your symptoms, decreases the severity of your symptoms. So there's a lot of research going on at academic medical centers, at NIH, at CDC, looking into long COVID. It's a complicated question, but we are learning more each day. But I, again, want to make that point that there are multiple studies now showing if you have long COVID and you're not vaccinated, if you get vaccinated, you may be able to decrease the duration and severity of your condition.
Mm-hmm. All right, so we have one more question before we move on to our next panelist. Danny is on the line with questions about vaccines. Danny, good evening.
Good evening. My name is Danny. I use they, them, or he, him pronouns. And I had 3 questions, so they all kind of relate to each other. Firstly, which brands, versions, whatnot of the vaccine are there? Secondly, which ones are okay to mix and match? And thirdly, which ones are recommended for which demographics?
I can grab that quickly. Right now it is high, data emerges. What we know in the beginning with time changes. And what we know now is that the mRNA vaccines, the Moderna and Pfizer vaccines, they are better than the Janssen vaccine. We didn't know that in the beginning, the Johnson & Johnson vaccine. So if you got the original dose, my husband, my son, they got the Janssen or Johnson & Johnson vaccine. What we know now is that you need to follow up and get another dose of either Pfizer or Moderna. Now, which one to choose between Pfizer and Moderna? I guess there is a little bit of evidence that Moderna gives a little higher level of protection. The dose of that vaccine is higher and it's spread out. The 2 doses are 4 weeks apart instead of 3 weeks apart. And so those are things that could make it a little bit more effective. But I would say either Pfizer or Moderna vaccines, to my mind, they are just about the same. They differ just a little bit in some special sauce kind of things. I would say either Pfizer or Moderna. And in terms of mix or match, again, I think there is sort of mixed evidence. There is some evidence that if you got your original 2 doses of one vaccine, whether that's Pfizer or Moderna, maybe there's an advantage to getting your booster with the other one, but that's not certain. The most important thing is to just get that booster.
All right, thank you so much for that, Dr. Kelly. And moving on, we have Miss Rosalind Goodwin. She serves as a Vice President for Engagement for the South Carolina Hospital Association. She is passionate about improving the well-being of populations through health and human services. Rosalind serves as a primary link with many private and public sector stakeholders, including policymakers, community and advocacy groups, insurers, and employers. Ms. Goodwin, thank you for being here tonight.
Thank you for having me.
So, Ms. Goodwin, can you speak about the state of South Carolina hospitals as it pertains to capacity that they have experienced during COVID?
The good thing is that the numbers of hospitalizations are going down as far as capacity. There were times and peaks during the pandemic that there were a few hospitals that had to divert. There just was not capacity there. We didn't have too much of that just because we had such wonderful partnerships with DHEC and other statewide stakeholders, the Army, National Guard, and so many people who stepped up for us to partner together to make sure that we did not get to a place where there were other states that, you could not get into a hospital and people were being seen outside of the hospital walls. So we never got to that point. Fortunately, here in South Carolina, what we're seeing right now is that the population who is hospitalized is younger. It is that same population that Dr. Kelly spoke about, who may believe that they're invincible and they have not been vaccinated. We quickly saw that COVID became a disease of the unvaccinated. We literally had our hospitals post on a daily basis. We kept seeing 80+% of those who were hospitalized were not vaccinated. We saw it day in and day out, and it has been the same way with this new Omicron variant. We're just seeing that age of the population that's hospitalized right now is younger, and they're staying in our hospitals longer. So if you have been participating and listening in on this, I hope this has really been encouraging, particularly if you may not be in that 18 to 30 age range, but you have people around you who are. Just look around your sphere of influence. It may be a child, a niece, or a nephew, a cousin, a neighbor. Really encourage them. And I don't think we're saying enough about this, that the people who are in the hospital right now are young people, and they're staying in there a very long time. There are people who are still losing their life due to COVID. And I hope this has been encouragement for people to go ahead and be vaccinated.
Ms. Goodwin, can you speak to the importance of a trusted resource when finding a place to get yourself or your loved one vaccinated? For so many people, there's a lot of information being thrown out there.
Absolutely. And, I'm a Black female, so I'm thinking about Tuskegee. I'm thinking about all these other things that we've had that did not go well in our past. But I relied on my primary care physician. I relied on my children's pediatrician when it was time, when the age range opened up for them to be vaccinated. I've got a 15-year-old and I've got an 11-year-old. So my 15-year-old, of course, was able to be vaccinated first, but I talked to our pharmacist. I talked to our pediatrician. When it was time for my son, I talked to our pharmacist. I talked to our pediatrician. You rely on the scientists. You rely on the people who've invested years of their lives to study medicine, not what's going on TV, certainly not what's going on social media and everybody's conspiracy theories. This has just really been just so pressed on my heart and personal for me, because before we were able to get the vaccine, I found my best friend of 37 years, my maid of honor, my children's godmother, and high school classmate. We spent our entire lives together. I found her dead in her home from COVID. Now, she would have been vaccinated had she had the opportunity to. None of us over the age of 5 we don't have that excuse. The vaccine is readily available for all of us. So please don't pay attention to social media or even some of the news channels. Some of those are slanted and people have agendas. We do want you to trust and go to those trusted sources who are in the medical community. And you've heard a lot of great advice tonight. So I hope you are able to implement it and protect the people in your family and yourself.
Ms. Goodwin, we have a question specifically from you we're going to go to the phone lines from Walter. Good evening, Walter. You wanted to talk to Ms. Goodwin.
Hi, good evening. Thank you for your time, and thank you for sharing that personal experience. I was very curious as to the fact of during COVID, hospitals were inundated, things were happening, and we were having to put off other surgeries, other procedures for people that needed things. How is that going in Richland County? Have we gotten better with catching up to those other people's needs?
Right, we have gotten better. There was a time that our state officials requested and asked our hospitals to stop having elective procedures. And that was during the peak and the heights of COVID and these various variants. We're not at that point right now. So if you put off some type of procedure that, and we use the word elective. I know for you, if you're desiring or need a procedure, nobody thinks anything's elective. I had to wait for an elective procedure and I didn't think it was elective, but we are definitely better now here in Richland County. I would encourage you to reach out to your medical professionals to go ahead and get that scheduled, because this is a time that the numbers are going down and hospitals are not required to postpone or prolong elective procedures.
Okay, Ms. Goodwin, thank you so much for that. We have a question now. Manuel is on the line about treatment. So this question could go to anyone. Manuel, good evening.
Hi, good evening. How are you doing? Thank you for accepting my question. Yes, my question is about, we have been relying so far in vaccines. I know the virus is a virus, so it's up to the immune system to work with. My question is if there is actually a protocol for the medical system to treat someone with this disease. For example, we were talking before about long COVID, and what are the causes and consequences of that? And if it's the same, of course, if the person is vaccinated, it's not the same. But for example, there are antivirus drugs that are available today, but I didn't hear anything about it. It can be applicable at home, it can be applicable at the hospital, and what are the reasons to apply it or not apply it?
I was going to say Dr. Kelly can speak more on this, but the difficult part that I find as a practicing clinician here in South Carolina is the availability of the medications that we have to be able to treat individuals who we find that fit the criteria for the medications. So as we have, when we have a virus and we use antivirals, they're not 100% as far as being able to work and make the disease go away. There is no cure There are things to help the disease not progress and not get worse. But again, a lot of the medication is not just readily available. I had a patient who was found to have COVID-19 just today. Trying to get them some of the available medications was quite difficult. And calling around, there's 2 oral medications that are eligible for people who are eligible, who potentially could have bad consequences if they had not gotten this medication. And those who are severely immune compromised, there is infusions. It's not readily available. And so, making sure that number one is we get vaccinated so we prevent getting to this point is, what we really need to do. Yes, there are some availability as far as medication, but it's not like, if you have, diabetes, I can just write you a prescription and you can just get this medication, walk out the door and get it. It does not work that way, and nor does it work that way across our country. I would love to hear what Dr. Kelly has to say about this.
Well, in brief, an ounce of prevention is worth a pound of cure. And that's why we talk so much about vaccination. But you raise a good point. There are certain medications that are useful in preventing progression to severe disease. So, for example, if you test positive for COVID, whether you've been vaccinated or not, it's important for you to contact your healthcare provider and ask, am I eligible to receive any of these medications? Because there are a number of different choices. There are 2 different kinds of pills. There's monoclonal antibody infusions. There's also something called Regeneron, which is also an IV treatment. But as Dr. Stewart was saying, they're in short supply. And those supplies are increasing, but we're limited, how fast can they manufacture them? So we don't have enough to go around. So often it is saved for the person who needs it the most. But I think it's important that everyone have a healthcare provider. If you don't have a healthcare provider, get one. Make a contact now so that if you test positive for COVID, you can contact them and say, hey, can I get any of these treatments to help prevent me from progressing to more severe disease? So I'm glad you brought up those treatments. Those treatments need to be given in a timely fashion, meaning if you test positive, some of them have to be given within 5 days for them to work. So if you have symptoms, you think you've been exposed, get tested. If you test positive, talk to your healthcare provider. Don't have a healthcare provider? There are telemedicine places that you can contact online.
We're going to open up the phone lines. We have another question. We have about 3 more minutes left. And so we have Lisa on the line. Good evening, Lisa.
Hi, thank you for taking my question. In line with what has been said here, the last question and the advice that was given by one of the speakers before to not live in fear and to go out and interact with people because there are treatments, is the fact that some people, even who are vaccinated and then get COVID, are living with long-term effects from long COVID. Is that being taken into account when giving this advice?
Yeah, and so again, any kind of intervention, preventative intervention to ensure that you don't develop long COVID, you ensure that you don't have an adverse outcome with COVID, is informed by well-being. And the most fundamental component of well-being and the biggest mediator of our immune system, the biggest thing that suppresses inflammation in our immune system and keeps us healthy and well, that helps us keep us moving, that helps us to eat right, it's meaningful interpersonal interaction. Why is it? That's just the way that human beings are designed. Human beings were designed to engage in meaningful interpersonal interaction. That meaningful interpersonal interaction really tamps down those adrenal glands that if they get too overactive, it really alters the way the immune system functions. And so what we can't do is, just based on fear, remove ourselves from engaging in those meaningful interpersonal interactions, because it will have untold consequences. And the reality is that for the most part, folks are doing well with COVID. And the biggest reality is that if you're vaccinated, you will do well with COVID per the best data that we have, with rare exceptions. And so those meaningful interpersonal interactions, you got to have them. That's our resilience juice. that keeps us healthy and well and moving and eating right and sleeping well.
Dr. Loper, thank you so much. So for this last question, it would be directed to our panelists. We'll give each of you on at least 30 seconds to answer so we could wrap up. As a professional who works with COVID-19 daily, how do you address skepticism around COVID-19, the vaccination with your family and friends? We'll go ahead and start with you, Ms. Goodwin.
I take out a picture of my best friend with my children. It was at one point, particularly, that 80% of Black Americans knew someone who had been hospitalized or died from COVID. So there are very few people that I'm around who don't have some type of personal connection or story. It's part of the way that I'm honoring her legacy and participating in panels like this. I'm doing everything I can to encourage people to be vaccinated. But I just share the personal story and how we have had to dealt with probably the most painful moment of my life over the last year. So I think once we make it personal and we recognize that there are real people who suffered from this, hopefully it helps to change people's perspective.
Dr. Loper?
Spoken like a true psychiatrist, I like to come at it from the point of view of the deepest empathy that I can possibly generate, because we understand that resistance to engaging with data and resistance to acknowledging the efficacy of a vaccine or other interventions is simply mediated by fear and anxiety. And I have the deepest empathy for folks because it is scary times. These are uncertain times, and we have to acknowledge that. And different people are going to manage that uncertainty in different ways. And our responsibility as clinicians is not to dictate for you what you do. It's to help support you in navigating those feelings of distress that are manifesting as the avoidance and withdrawal of engaging with the appropriate evidence-based interventions to keep you and your family safe.
Got you. Got 40 more seconds. Okay, Dr. Stewart, really quick, and then Dr. Kelly.
Real quick, I make sure that I listen to concerns and address them and try to meet them where they are. Talk about my experience within my clinics and, the good, the bad, and also my experience with the vaccine. And it's important just to listen. Everyone has a different lived experience, and we have to listen to concerns of others so that we can best address those in a way that really helps them.
Thank you. And finally, Dr. Kelly?
I'd say share your stories. If you are vaccinated, share your stories with the people you know about why did you get vaccinated and what did you experience? Because so much of this is fear of the unknown. And if you're not vaccinated, ask questions. If you've got questions, ask them, but don't ask them on social media. I'm sorry to say that. I think that there are too many rumors, too many inadequate responses. If you don't like government websites, that's fine. Go to an academic website. Look at Children's Hospital of Philadelphia, a leading pediatric facility in the United States. They've got extensive information on COVID vaccines. You are welcome to email me directly also with any of your questions. If you have a question, lots of other people do. And I will give you my email address. It is Kelly, KELLY, JM, the number 1 at dhec.sc.gov.
Dr. Kelly, thank you so much for that. Well, time has gone by. I want to thank everybody for being part of this informative discussion. And we want to thank you all for joining us tonight. If your question was not addressed during the community Tele-Town Hall, please stay on the line to leave us a message and we will return your call in the morning. Also, we wanted to let you know that this recording will be posted on richlandlibrary.com later this week. Please consider sharing it with others. Once again, thank you very much. My name is Fraendy Clervaud with Richland Library for the Community Tele-Town Hall. You all have a good night.